Well, I think we've seen a steady decline since the last time I was on the programme, not perhaps as fast as many of us would have liked, but certainly a steady decline right across the country. And indeed, for the first time last week, London recorded a number of deaths which was below the 5-year average. So that's really good. So I think we're moving into a new phase. The virus certainly hasn't gone away, and we need to move into a period of surveillance and real vigilance to identify any outbreaks and move to get on top of them really, really quickly.
The decline is obviously good news, but you also said not as fast as you would have liked. And those graphs for new infections, they look quite flat at the moment rather than that they're simply heading down.
Well, let's just look at the data that we are getting from our very large survey, which looks at infections. And a few weeks ago, we were reporting about 0.24% test of the population of England testing positive to our swabs. That's down to 0.06%, a fourfold drop. But yes, we've seen that fairly constant for the last couple of weeks. So that's around about 3,000 new infections a day. And as I indicated, that's a relatively low level, but we need absolutely to be vigilant in monitoring that, identifying any new outbreaks, such as those we've seen recently in Anglesey or in Cleckheaton, and really moving fast to control them.
Now, there's obviously a delay, a lag between ending the lockdown or easing it and new cases, if there are going to be any. So when will you know whether the recent easing, whether the next stage of easing actually starts to produce an uptick in the cases?
Well, we have a survey, which is a very, very large survey, which we're actually increasing in size at the moment to get it up to one of the largest surveys we have ever done on any topic. And that's a weekly survey, so we make weekly estimates. I just have to be honest and say my own belief and that of the Office of National Statistics and others is that this virus is going to be with us for a long time, and we're going to have to be absolutely vigilant to check that we are on top of the outbreaks which will come. But we need to really, really be quick in acting so as to make sure that we do not get a large second wave.
Now, one of the points of this very big survey that you're doing is to try to tell us how many people have had the disease over time, not just got it now. What can you tell us?
I think that's right. So as well as measuring whether you've got it at the moment, from a sample, we take blood tests, which enable us to look at the proportion of the population with antibodies. And what we're finding is between 5 and 7% of the population, more in London, have had that. And that suggests to me that around about 3.5 million people in England have had have either had the virus or have natural antibodies to it.
The ONS, the Office for National Statistics, came up with the evidence to back what we knew, but nevertheless is shocking that, for example, black men are twice as likely to die as white men, black women 1.4 times as likely as white women, and you're more at risk in other ethnic minority groups as well. What people urgently feel they want to know is why, because that might help them know what to then do about it. Are you going to be able to give us some of those answers?
We are doing everything we can to improve our understanding. And so, in our most recent work, we looked very much at the fact that we know that there is a real gradient in health and indeed mortality towards the most disadvantaged members of society. And we know that Black, Asian and minority ethnic people are more highly concentrated towards the more disadvantaged end of society. And so we ask the question, is it that it is to do with disadvantage alone? And I can report that it isn't just to do with disadvantage alone. We've also looked at occupations, so we can say that occupations like taxi drivers, like security guards, like healthcare workers have higher mortality. And again, that doesn't control out all the excess mortality that we are seeing amongst people from Black, Asian and minority ethnic groups. So we will be continuing that work. We're continuing that work now to look at data from hospital episodes to understand health factors as well, and we will continue to get further granularity on the work that we've done. This is a really, for us, an incredibly important and worrying area, but one that we will continue to do everything we can to provide the information the country needs.
Now, you have this rather grand title, National Statistician. Does it sadden you that in recent weeks people have got pretty sceptical about the numbers they're shown each day in those Downing Street briefings? Does that worry you, that the faith in statistics, the numbers, has been eroded?
I actually disagree on that, Nick. I have spent my life as a statistician being told statements like that, and yet during this pandemic, I think we have seen data used and available in a way that we haven't seen before.
But when it comes to testing, of course, when it comes to testing, the chair of the UK Statistics Authority, Sir David Norgrove, ticked the government off, didn't he? He said these testing statistics are well short of expectations, he said. They've been widely criticised and they're often mistrusted. And at the moment, we don't have any stats on testing.
Well, when Sir David wrote, in my capacity as head of the Government Statistical Service, I immediately asked one of my deputies to go and work with the Department for Health and Social Care to work on those data, and I'm very conscious that we will see some pretty good data coming out in the next week or two, and I'm also conscious that Baroness Harding is absolutely committed to transparency, openness and accuracy in statistics, and in my capacity as head of the Government Statistical Service, I will make sure that we do everything we can to help deliver that.
So in simple terms, you're saying, I think it wasn't good enough, but we are now sorting it.
We're certainly working very hard to make sure that we bring transparency, openness and accuracy to our statistics. And Nick, I'd have to say that all the feedback that we are getting at the Office of National Statistics is that our data at the Office of National Statistics are trusted, valued, and I have to just, a shout out to the very many thousands of my colleagues who have been working all the hours that there are in order to provide our nation with these wonderful data on which to make policy and for you and I to have a discussion about.
Yeah, one of the other things you do is sit on that famous committee, famous now, SAGE, that gives scientific advice. Now, I know the rules are that you don't tell us what's been decided, but people will be intrigued today to know how it works. On this 2-metre rule, is it as simple as ministers saying, we want to do this, yes or no, or is it much subtler, much more nuanced than that?
There is never, almost never, a black and white or white answer. That's why there is real nuance in everything. So in the example you give, there is incredible nuance as to distance with regard to mitigating factors and things like that. So some of it is to do with communication. Let me give you an example. I understand in Siberia, what they've done is to have pictures with 2 people, and the Russian distance is 1.5 meters, and in between is a medium-sized bear, because that's something that people think of as 1.5 meters. We need to be thinking about our communication in a way which enables people to be able to socially distance, to wash hands appropriately, to use face covering, all those things, and what the implications of each of those are for mitigating transmission.
We have a simple answer at the BBC. It's 1 Hugh Pym. Lie him down, that's 2 metres. It works very well.
Fantastic.
Professor Sir Ian Diamond, thanks so much for coming on the programme.
It's been my pleasure. Thank you very much.